So now we get into some of the pathways for bone to kind of change itself over time. How bones grow, how do they remodel themselves, and how do they repair themselves if damage is to occur. If you think about it, when you think about how big you were when you were born, right, you've obviously gotten a lot larger since then. And yet your bones have gotten larger too, so even though they're rigid, they've gotten bigger. How did they get bigger? And there's a few kind of key players in all of these processes of growth, remodeling, and repair. So some terminology we want to get familiar with before we get into each of these processes. We have the osteoblasts, the osteocytes, osteoclasts, and chondrocytes. So we see some common themes again. We see osteo, which tells us bone, but now we have some new ones. Blast, I'm not sure if we've covered that just yet, but osteoblast, anytime you see blast, this is going to be some sort of cell that's going to form something. It's going to make something. So an osteoblast is a cell that makes bone or forms bone. The osteocyte, that's been our key example over and over and over again throughout the semester. But if we break it down, osteo means bone, cyte means cell, so these are bone cells that are just doing the daily tasks of bone. And then the osteoclasts. Osteo tells us bone, clast tells us that we're absorbing or we're breaking something down. So if you see clast in any situation, that tells us that we're absorbing or breaking something down. So osteoclasts are going to be cells that absorb bone. And then chondrocytes, we already see cyte, we know that that's a cell, but chondro has to do with cartilage. So chondrocytes are cartilage cells. And all of these are going to be key players in the process of growing, remodeling, and repairing. So how do bones develop? The main idea is that they are going to ossify or go through a process of ossification, which is the formation of bone itself. And there's two ways that we can do this. Intramembranous ossification. This is where you have sheets of fibrous connective tissue and bone is going to develop between those two sheets. This is used for flat bones like your ribs. And endochondral ossification. Most other bones are going to use this process where we start with a cartilage framework and then we replace it with bone over time. And that's the one that we're going to go into. We're going to care about the most is the endochondral ossification process. So how does it happen? We start with a cartilage base. So chondrocytes are going to lay down hyaline cartilage in kind of a rudimentary shape of a bone. And that's going to serve as our model or serve as our framework. From there, we start to form a bone collar. So those osteoblasts that build up bone are going to build up the hard calcium matrix of the bone and form a collar of compact bone around the model. We then have primary ossification center. That's where the osteoblasts are going to be brought inside of the model and they're going to start laying down spongy bone. So we're seeing both types of bone, compact and spongy, forming at this point. After that, we're going to have the inside start to hollow out. So the middle of that diaphysis, the shaft of the bone, is going to start to hollow out and form the medullary cavity. And this is where the osteoclasts come in, where they're going to absorb any extra spongy bone in that diaphysis that's not needed. We're also going to see secondary ossification sites form up in the epiphyses. So at the top and the bottom of the bone, where it's kind of rounded out, we have secondary ossification sites. And then finally, we have an epiphyseal plate or a growth plate that we see in the epiphysis. It's going to be a cartilage band that runs across, and that's where we're going to go through the lengthening process. So if we look at this in an image, right, here's our kind of general framework made of cartilage. Kind of looks like a bone, somewhat. And this is going to serve as our framework to build actual bone on. We see that compact bone collar forming around the diaphysis, around the bone. Remember, this is still cartilage on the inside. Blood vessels are going to start to kind of branch into our framework. We're going to have our primary ossification center laying down spongy bone all throughout. We have some secondary ossification centers that are starting in the epiphyses. And we see the osteoclasts are starting to resorb some of that bone in the middle to form the medullary cavity. And then as we get older, right, as we go through childhood and we grow, we get taller, our epiphyseal plates, or the growth plates here, are going to allow for that extension of the bone. So that lengthening process of the bone is going to come from those growth plates. And so let's take a closer look at that growth plate and what it's kind of doing. So we see here's the epiphysis. We're moving down into the diaphysis down here where it's kind of off the image. And we see that we're proliferating, so we're dividing, and then we kind of become ossified over time. We get replaced with bone as we move down this. So we start as cartilage, and then as we lengthen, as we proliferate, we're going to be replaced with bone. We do need some signals to tell us, tell our bones to grow. And so hormones are going to be one of the primary ways to communicate with bone to allow it to grow. Vitamin D is going to be one that's going to be converted into a hormone that allows us to absorb calcium. We need that because calcium is one of the main pieces to that matrix, that main part that's going to give us the rigidity and structure of bone. So vitamin D is absolutely important in order to build bone, to bring in the building blocks we need. Growth hormone, just general growth hormone, is going to stimulate just general bone growth. And then sex hormones are also going to increase growth during adolescence. So when you go through puberty and you have the sudden surge of sex hormones, they're going to be contributing to the growth of bone. Right? And that's why you have like your growth spurt around that same time. Right? I remember when my little brother went through puberty when he was 12, 13, and he was maybe 5'3" or so when he was 11, 12, and by the time he was 15, he was over 6 feet. That's a lot of growth that just happened in a relatively short period of time. Well, we don't just lengthen the bones, we don't just, once we get to a certain height, we just stop. The bones are constantly remodeling and constantly changing and recycling themselves over and over and over again. And so we see about 18% of your bone is going to be recycled every single year. And the reason being is that your bones really do serve as a good reservoir for calcium. So calcium can be stored away in the bone, and then if it's needed, we can kind of break bone down just a little bit to release that calcium back into the bloodstream. And so we have two hormones. We have two hormones that are going to be responsible for that. We have the parathyroid hormone, or PTH. This is going to help speed up the breakdown of bone so that we can deposit calcium into the bloodstream. So we're going to raise blood calcium by breaking down bone with PTH. And calcitonin, which comes from the thyroid, is going to decrease blood calcium. So calcitonin, the way I like to say it is calcitonin puts calcium in the bones. Right? It puts calcium back in the bones. We build up that bone and we lower our blood calcium level. Now, we do go through remodeling not just as a way to moderate how much calcium we have in the blood, but also so that we can not just lengthen the bone, but we can widen the bone. If you think about how tiny you were when you were a baby, think back to that again. And you think about how narrow those bones would be. You think about how if you just lengthen them, you would have these really skinny, like pasta bones, and that wouldn't be very beneficial for you in the long run. So not only do we lengthen bones, we also widen them, and in order to increase that diameter, to widen that bone, we go through the process of remodeling where we basically are going to absorb and break down bone from the middle, or from the middle portion, from inside here, and we're going to lay it on the outside. So we're just kind of taking this inner layer and wrapping it around on the outside. Take the inner layer, wrap it around the outside. And so by doing that, we're conserving some components. We're being efficient with the materials we have, while also making these structural changes that are absolutely necessary. That being said, sometimes bone is broken down too fast, and we don't have enough calcium, we don't have enough bone laid down to maintain real strong structure. And in this case, you would develop what's called osteoporosis, right? Osteo, you think bone, pore, or porosis, you think pores or holes. And so this is a condition where bones are actually weakened to the point where they can fracture, they can break, because the bone mass has dropped down too low. This is something that tends to go with age. So as you get older, your body is going to break down or absorb more bone than it can lay down. And this starts to happen around age 40. There are other risk factors involved, including being female, white, Asian, thin, having a family history, early menopause, smoking, low calcium, excessive caffeine or alcohol intake, and a sedentary lifestyle. Now, we recognize that some of these risk factors a person cannot control for. You can't control your gender necessarily, you can't control your race or your family history, but you can control whether or not you smoke, you can control your diet, and you can control your lifestyle. And so making sure, especially if you have one of those unchangeable risk factors, it's especially important that you maintain a healthy lifestyle and that you're avoiding the risk factors that are avoidable. That being said, just because you're male or you're not white or Asian or you don't have a family history doesn't mean you have a free-for-all when it comes to alcohol, diet, or your lifestyle. You should still maintain a healthy lifestyle because, as we've seen, those things are going to be risk factors for a lot of other conditions as well. Now, osteoporosis, because we've weakened the bone, does lead to fractures and other complications. When we look at fractures in the elderly, we actually do see a very severe drop in lifespan after that fracture. So it's especially important for the elderly to avoid those fractures, because as you get older, your healing process, your ability to come back from some sort of injury like that is going to drop significantly. And then you develop risks of like bed sores, risks of blood clots that can come from having to stay still for so long to heal. That being said, osteoporosis is not a death sentence. There are drugs, there are medications, there's hormones that can be given to a patient, and then also there's lifestyle changes. Right? If you know you're at risk of osteoporosis, you're in the early stages of it, then you know you have to increase your calcium intake, stay active, and avoid smoking or stop smoking if you already do. But let's say worst case scenario happens and you trip and fall and you break your leg or you break your arm. What's going to happen? Right? Your arm or leg is not stuck like that forever. You have repair mechanisms built into your body in order to fix that bone. Keep in mind, if you remember from the last couple videos, that bone is living and there are blood vessels running all throughout that bone. And so the very first thing that's going to happen when you break your bone is some of those blood vessels are going to break along with it. And as we've learned, those are going to form blood clots. They're going to clot to prevent blood loss, right? To prevent excessive bleeding. So the first step we see in bone repair is the hematoma, which is that blood clot forming between the broken bones to stop the bleeding. And that's going to happen in the first few hours. After a few weeks, you're going to start laying down a fibrocartilaginous callus. This is just a cartilage-based callus that's going to form between the broken bones. So we're forming a cartilaginous bridge between the two pieces. That's going to be in the first few weeks, the first like 3 or so weeks. From there, you form a bony callus, which is going to take 3 to 4 months, where we're going to slowly replace that cartilage with bone. So kind of like how we saw in the endochondral ossification process, where we started with a cartilage model and we replaced it with bone over time. We're doing that as well in repair, where we start with cartilage and then we slowly replace it with bone. And then for the remainder of that person's life, that bone's going to go through remodeling, where the old bone tissue gets broken down, new bone tissue gets laid down over and over again, and we're going to remodel that bone to make it look as normal as possible. So let's look at some images of this, or look at some depictions of this. So here's our hematoma. Again, we see that there's blood vessels running all throughout that bone. When this bone breaks, the blood vessels are going to break with it. We are going to have some bleeding, and we're going to form a hematoma. We're going to form a clot between the two pieces. We're going to slowly, over those first few weeks, lay down a fibrocartilaginous callus to bridge the two pieces of bone together. We're going to replace that cartilage with bone. So we see it's just kind of generic spongy bone that's been laid down. And then we'll go through remodeling over the next several years to kind of completely heal up that fracture. Right? And so this is why you have to wear a cast. You have to kind of stay off that limb for a while, is because this process is going to take a few months. That being said, bones do repair themselves faster than a lot of other tissues, like ligaments or tendons. And it's because we have this direct blood supply in the bone. So ligaments, tendons, they don't have that luxury. Bones do.